proposing a quarter trillion dollars in new ACA spending. My question, do those go to people or insurance companies?
Do those investments go to, well, it translates into a record number of Americans getting insurance.
Does the money, does the quarter trillion dollars go to insurance companies?
The investments make sure that Americans can afford to purchase the insurance they need to get health care coverage.
How high of a deductible would you consider affordable for someone making the median income in this country, which is around $70,000? So how high of a deductible is affordable?
Rather than give you a speculative answer, what I can tell you is that 4 out of 5 people who are looking on the website for healthcare.gov are finding a health insurance coverage plan that gives them a real quality coverage for $10 or less a month in premium price.
Do you know the average deductible of a silver plan?
There are many different deductible levels based on the plan, and
it's over $5,000. Okay, in your statement, you talk a lot about lowering the drug prices in this country. Your budget includes the expansion of the price controls, but fails to include any detail on whatsoever those expansions would if they're actually going to work. We've also been waiting for years for this administration to enforce price transparency requirements for pharmacy benefit managers and insurance that the former administration finalized to unwind the black box created by these middlemen. So Ranking Member Pallone and I applauded CMS when they announced enforcement was coming last September. When can patients expect HHS to enforce, but it still hasn't happened. So when can we expect HHS to enforce the drug price transparency rule?
Congressman, we are currently enforcing that law. We're doing it as best we can. As you know, it has gone through a number of iterations in the courts. We continue to try to implement the letter and spirit of the law.
Okay, so we're still waiting. Okay, we're still waiting.
Well, we have to make sure we follow any court rules.
It's only been 3 years. Okay, moving on. Secretary Becerra, rulemaking can also have an impact on the budget and federal spending on mandatory programs such as ACA tax credits, Medicaid, Medicare. CMS has been finalizing a number of regulations just in recent weeks. For the 2025 Obamacare rule, will policies finalized in that rule increase federal payments to insurance companies or decrease?
Will the 2025 rule?
Obamacare rule, so the federal payments to insurance companies, the premium tax credits, is that going to increase or decrease federal payments to insurance companies?
Well, the subsidies that Americans now can qualify for to help keep their insurance costs down will help make sure those plans are more affordable for Americans.
So I'm asking about the money that's going to the insurance companies. Is this going to be millions, tens of millions, billions, tens of billions?
The plans are operated and offered by private insurance companies within the Affordable Care Act marketplaces.
How much federal? Okay, sorry, go ahead.
And so when we provide the subsidies will flow through the insurance companies so that they reduce the price for those Americans who get the coverage.
Going to the insurance companies, and I guess we don't know how much. For the rule titled Streamlining the Medicaid CHIP and Basic Health Program Application Eligibility Determination Enrollment and Renewal Process, so that's the rule. Does that rule increase or decrease spending by the federal government on Medicaid over the next 5 years?
On Medicare or Medicaid?
Medicaid, yeah, Medicaid.
It makes sure that Medicaid recipients can afford to get the coverage they need and expand.
Does it increase spending?
An investment to make sure that more Americans qualify for Medicaid is going to be good for those Americans.
The question is how much? Do you know how much more this rule is going to require in spending by the federal government? Or are the state governments just expected to spend because of this rule?
Well, remember, Medicaid is a state and federal matching program, so much will depend on what the states do, but the federal government.
I'm going to run out of time here soon, and I'm still not hearing an answer. I know $45 billion more on spending by the federal government on Medicaid in the next 5 years alone, perhaps more. So I find it shocking in preparing for a budget hearing, making repeated statements about commitment to longevity and success of these programs. You can't even answer if we're going to have to raise taxes or not to pay for these or program reductions. Do you have any process in place where rules that increase spending by the federal government actually get any kind of accountability or responsibility, because Congress has to pay these bills.
Congresswoman, as you know, and as I know from having served where you are, that we cannot spend money we don't have.
Well, you're passing a lot of rules that are committing a lot of money.
And those rules cannot commit us to spending money we don't have.
More to come. I'm out of time. Yield back.
The chair yields back, and the chair recognizes the ranking member for 5 minutes for questions.
Thank you, Mr. Chairman. Mr. Secretary, I'm going to try to get through two issues, hospital price transparency and Medicaid unwinding. So if I make it, ask you to shorten your answers, it's only because I want to get through both. A major bipartisan